And thanks for coming back. So, doctor, what's the youngest age of patient that you've had experience treating?
Well, the youngest that we treat, I mean, we treat down to newborns, but we see a lot of kids that have wheezing and reactive airway disease, particularly, down to 4 to 6 weeks. Some of that is caused by viral infections, and we're just coming out of the winter season when respiratory syncytial virus, or RSV, was a big culprit, and we see a lot of kids that come in with asthmatic type symptoms that actually have RSV. And there is some thought of, does RSV cause asthma, or how does that all relate? Because about 2/3 of the kids that have significant RSV infections will develop asthma. But the million-dollar question is, does RSV cause asthma, or do the symptoms present because the child is predisposed to asthma and the RSV just triggers off what is already there? But as far as diagnosing asthma, it's hard to diagnose asthma in a child under 18 months to 24 months of age, simply because there are so many things that can cause wheezing that are not, first of all, recurrent, and that is the key factor in diagnosing asthma. It's a repetitive disease, and it's also reversible. A lot of things are reversible. Viral infections are reversible, and the wheezing that you have with the viral infection in the lungs will eventually go away. But it's the repetitive nature over time that sort of gives us a clue as to whether a child is asthmatic or not. And like I said, we're a little hesitant to make that diagnosis because once you're labeled as an asthmatic, you can't get rid of the diagnosis. And then all of a sudden you have difficulties getting health insurance and life insurance and all the other things that go with chronic medical conditions.
All right, thank you. So Teresa, as I said, is the new coordinator for the respiratory therapy program here at the college. And Teresa, I wanted to ask, what is a respiratory therapist?
A respiratory therapist's primary responsibilities are in the diagnosis, treatment, and rehabilitation of patients with lung disease, or persons who are on life support, who are unable to sustain their own breathing. We help them breathe until they are able to take it over on their own.
I see. And our program is getting ready to start, and can you tell us something about our program?
Okay. We are in the process of seeking accreditation. In order for any program in the medical field to teach at the college level, you must be accredited. And this is for two reasons. One, it protects your students. It makes sure that when they spend money on a program, that institution is teaching what that student needs to know in order to survive out in the field in that particular discipline. And in my case, it's respiratory therapy. So accreditation makes sure that if an institution desires to teach students, are you covering all the bases? And you have to go through each step and make sure that everything's covered. Not only the lecture or the didactic aspect of teaching, but also the clinical aspect. Are they going to get all the necessary clinic hours they need in order to achieve that skill level that they will need to survive out in the workplace? And also it helps them get up to speed. With the hospitals the way they are today, they don't want to start fresh with a student. They prefer to have a student who can hit the ground running and not have to be watched so closely. They want somebody that can handle situations on their own. And so this is also what we are to do. We are to help a student achieve that level by the time they graduate, to be able to hit the ground running, so to speak. Secondly, it helps them pass their accreditation standards. We have 2 accreditation level tests in the field of respiratory therapy. The first exam would be the certified exam, credentialing exam. And this is the first exam a student would take, and this is really the easier of the two. There's usually around, I believe it's a 92% passing rate for this particular exam with the Commission of Accreditation and the National Board of Respiratory Care. And then after they graduate, and 6 months after they graduate, they're open to taking the registry exam. Now this is a lot more complicated exam, and this exam ensures that this particular respiratory therapist can work in trauma centers. They can work in that specialized discipline of working with perhaps neonatology, working with the very young, also working with the more critical aspects of respiratory therapy. So most hospitals prefer to have the registered respiratory therapist in their facility because they cover everything, not only breathing treatments out on the floor, but they can also handle the young newborn baby who's been born maybe 4 weeks too early and they need some support. So the third thing that accreditation helps you achieve is it protects the patient. You want to make sure that your therapist knows what they're doing and can give the appropriate help to a particular patient, that they have a knowledge and understanding of certain conditions, and some hospitals have protocols in place where a therapist just goes in and assesses a patient, looking at their history, looking at assessing the patient's breath sounds and labs. And from this, they design a treatment protocol, and they institute that treatment protocol, and then they look at the outcomes from that treatment and make changes accordingly. So that also helps them with the accreditation. So you're protecting the patient as well. They know when that registered respiratory therapist comes in there, or that student graduate respiratory therapist knows what they're doing and can go ahead and work on their own, because respiratory therapists primarily work on their own with other healthcare providers, but they have the responsibility of knowing how to handle that critical, important emergency sometimes situation, and to look out for certain things.
So what kind of classes does someone take in respiratory therapy?
Well, it's strong on math and strong on science. So at Hutchinson Community College, we are going to require that our students have medical terminology. Medical terminology is a wide range of medical terms that you'll need to use to understand what's going on with your patient. The second thing that we require is anatomy and physiology. And this is important because you need to know the science aspect of what's going on, the anatomy of the patient and the physiology at the cellular level with what's going on with your patient. And of course, math, algebra. You are responsible for calculating your medication dosages in certain circumstances, and also in understanding gas laws and flow laws and pressure laws. They all use algebra, so we are asking that they also have intermediate algebra.
How long is the program?
24 months. They do have that first summer off, but that's it. The rest is hard work. The first year is probably the most intensive because it's all lecture and didactic. There are some labs. They do have one clinic in that first year to get their feet wet on what it's all about. And then they have the summer off, and then the second, third, and fourth, the summer after are, basically more involved with lab, getting used to working with mechanical ventilation, and more critical care oriented. So once you get through that first year, everything else builds on itself, and it's a little easier for the student.
Good. So what would someone do if they were interested in being a respiratory therapist? What's the first thing they should do here?
I would say call DJ Chastain. I'm not sure of his prefix, but 8100 is his extension at the college. DJ is the Allied Health Coordinator for Hutchinson Community College, and he basically is the person when they first walk into the door will talk to, because if they're a transfer student, and we've had several people call who are transfer students, they're going to talk to GJ. They're going to send him the transcripts, and he's going to evaluate the transcripts. He's been doing this many years, so he can look at a transcript and know where students' strengths and weaknesses are, and then he will go from there. If they haven't had anatomy and physiology, then we'll get them in. If it's been over 9 years, I believe, they have to have that again. And then once they've met their prerequisites, they can call Wendy Neal at the Davis Hall. 4956 is her extension, 665-4956, and she has the applications for the program. We probably will not begin the interview process until June, because we're working on the accreditation part. So.
Now, how many students will you admit this first year?
The accrediting body for respiratory therapy has said we could accept 12. So until we get fully accredited, we have to have 12 students, no more than that.
I see. So they should call DJ Chastain at 728-8100 if they are interested in respiratory therapy.
Mm-hmm.
All right. Well, thank you very much. I really appreciate you both being here today.
You're welcome.
And thanks very much to you for watching Health Matters.